All right. Welcome, everyone, and thank you for joining us tonight. We're excited to welcome you to Innovators in Medicine, another installment of YoungND's speaker series, Notre Dame Leaders. Today, we're hosting 3 of our Domer Dozen Honorees who were selected earlier this fall for their significant contributions and dedication to learning, service, faith, and work. Our conversation this evening with Abbey, Christy, and John will be about reimagining healthcare through innovation, empathy, and global collaboration. Before we get started, just a few notes to help our conversation run smoothly. This session is being recorded and will be posted to both YoungND's website and ThinkND's YouTube channel prior to tonight, post tonight. And we welcome any questions, so please use the comment feature on the right side of the page to submit questions for our speakers. So getting into our speakers here, Abbey Santanello is a pediatrician and current primary care sports medicine fellow at NYU. She has dedicated her work to helping children and families lead active, healthy lives. Abbey is also the co-founder and director of operations at the medical device company Vampiro and spent time during her residency working to strengthen the pediatric care system in Kenya. So thank you for joining us, Abbey.
Thank you.
Our next panelist is Christy Lucas. Christy is currently in her 3rd year of pediatric hematology and oncology fellowship at the Dana-Farber Boston Children's Cancer and Blood Disorders Center. After double majoring at Notre Dame, Christy graduated from Penn State College of Medicine and completed her pediatric residency at the UMPC Children's Hospital of Pittsburgh. With a focus in palliative care, Christy aims to use expressive arts to improve patient, provider, and caregiver experiences. John Templeton, our 3rd and final panelist, is an assistant professor in the Bellini College of Artificial Intelligence, Cybersecurity, and Computing at the University of South Florida. John's interdisciplinary work blends his education in computer science and biomedical engineering with a focus on smart health systems, human factor design, Internet of Things, mobile computing, and machine learning applications in healthcare that ultimately improve patient outcomes. John is also an award-winning educator with affiliation appointments at various medical institutions in the Florida area. Welcome, John and Christy.
Thank you all. Like I said, we're thrilled to have you and excited to get into this conversation. I think to start off, for folks that are perhaps not as familiar with some of the medical terminology that we just went through in your intros there, could each of you provide an overview about your individual areas of work and maybe talk a little bit about what drew you to those particular disciplines in the medical field? Abbey, if you want to go ahead and get started.
Sure, absolutely. So after I completed medical school, I started my residency time, which is a 3-year educational training period in pediatrics specifically. I was drawn to pediatrics primarily because I think that you can help impact children at a young age and set them on the right path and give them tools to be successful later on in life. And I really felt you could have a lot of that impact in the pediatric space and reaching these kids at a young age. To continue that and to give it a slightly different direction, I continue to pursue my educational training in a sports medicine fellowship. During this fellowship, I not only am now treating adults as well, but it gives me this opportunity to help people live healthy, active lives. And so it's been really a joy to work with these individuals that are passionate about bringing health and active lifestyles into their life. And this includes children and adults and all the way up to an older population. And to be able to see that growth and spread some of the latest innovation and science in this space has been very influential to my career.
Awesome. Thank you. John, how about you?
Definitely. Yeah. So I work in the computer science and engineering and biomedical engineering intersection. I actually started in biomedical engineering, where I played sports in high school, wanted to play in college, but was a little washed up maybe, and ultimately had to find a different path. But I have a bunch of family members that are in the medical field, a bunch of family members that are also engineers, and I wanted to merge the two areas together. Love technology. My work in the Bellini College is really focused on taking any and every type of technology that we can use and applying it to medicine. So I do everything from MRI sequence programming to app development for at-home care. I do novel device design. So if you can apply technology to it for medical applications, that's what my lab does. And it really gives a lot of opportunities for everything across the lifespan, like Abby was mentioning, working with children to help better understand their medications, and then all the way to adult populations that we're doing diagnostics for Parkinson's and Alzheimer's disease. So nothing is off limits in my lab if we can apply tech to it.
Awesome. Thank you. And Christy, what about you?
I work in pediatric hematology oncology, which means I take care of kids, which is a wide range of 0 to 21, sometimes a little bit older, who have blood disorders or cancer. And I, like Abby, did general pediatrics training for 3 years and was drawn to pediatrics for similar reasons, getting to take care of kids across the spectrum of development, their resilience. They always say the darndest things, and getting to partner with their families. And I was drawn to oncology in particular because of the long-term relationships that you have with patients and families. And the medicine was always interesting to me, but it was the ability to sit with patients and families in what was probably one of the most difficult moments of their lives, and to help them walk through that. And I think that's probably also kind of a thread of why I'm drawn to palliative care and seeking an additional year of training afterwards.
Awesome. Thank you. It's such an interesting field, obviously, as there's the total technological side of it, but there is the people and the emotions that you meet when you're working. And so I think it's really interesting to hear about how the two sides kind of come together. So to get a little bit of a better understanding of each of your day-to-days, maybe you could share a project or a piece of work that's maybe been particularly significant in your career and has kind of led you where you are today, and what were kind of some of the key takeaways from that project. I'll go ahead, and whoever wants to jump in first, go ahead.
I'm happy to jump in. So on reflecting on this, it actually takes me to a project that's outside of direct clinical care, and something that you mentioned in my intro, as well as my time working on my medical device company called Vampiro. This is something that came up during my time in the STEAM program, actually, which I pursued after completing my undergrad. And Vampiro is a medical device that's used in operating rooms across the country, and something we're working on growing. But what's neat about it is it was truly created from an idea, something from nothing, so to speak. And it was something where we saw a need for an innovation in healthcare. And it's honestly a little bit different from a lot of what we do in medicine, where if you pursue a clinical career, every next step. You go to college, you go to medical school, residency, fellowship, you do your clinical practice. It's very stepwise, and everything is kind of anticipated in some regard. But with Vampiro, it's taught me a lot about a journey that is not a straight path, and something that changes often. And I've learned that I've loved this, and I've kind of enjoyed this like excitement and new way of thinking. So not only do I want to incorporate entrepreneurship into my career, and has that influenced what I hope to do next, but also just this way of thinking that not every path is straight and well understood, and that there can be a lot of turns along the way.
Awesome. Thank you. I think we'll definitely be picking your brain a little bit more about Vampiro in a little bit. So thanks for opening up that conversation. John,
Yeah, I'll build off of that maybe next. For the path not being straight. That's why I like to think of everything as a network, right? From our end, is all these are building blocks. All these opportunities, are going to have some point of crossover in between them, which is why I really like what I do. My day-to-day is a little bit different because I am a professor. I do both research and teaching, and I have to be able to switch between those. I just finished up my required operating systems course, which is very, very tech-driven, very computer science heavy. But I'm excited to teach my Smart and Connected Health elective in the spring, where everything is research focused and everything is, growing these different interactions with clinicians. But I think really for me, the biggest benefit or thing that drives, my day to day is working with clinicians, working with patients from the technology angle to see what do they like, what do they not like, how can we make it better, used in their world. And one of the projects that I developed as part of my Shield Lab is a smart mouth guard. I do a lot with athletics as well, and building with the Department of Neurology and building with the engineers and trying to do this crossover between is an athlete going to wear this and what can we pull and how do we make the network for this device for not only concussion detection but general autonomic functions. Can we see how their heart rate variability interacts, how their postural control works, related to their athletic training, and trying to then build that system, I think is taking all the things that I've learned over the past decade and assembling those building blocks. There's going to be a ton of different ways to extend it in the future, but it's exciting to see it along the way and get to look at all those different avenues.
Absolutely.
For me, my day-to-day is a little bit of a mix of research and clinical care as well. And I also decided to take on a part-time master's, so I'm also a student again, because one of the things I learned at Notre Dame in a psychology of medicine seminar was my desire to challenge the status quo. And it started with the hospital gown projects in med school with the idea that sometimes the things that are important to people are not always the things that we think are important. And sometimes the way that we do things isn't the way that we ought to or the way that we should. It just becomes something that we don't question. And so that's kind of inspired my clinical care and my research and my want to go back to be a student again and to kind of unlearn some of those things I've internalized or that have become my status quo throughout my medical training to kind of reframe like what actually is important to people.
Just a casual part-time master's. Love that. Like it's nothing else.
A lot has changed.
That's amazing. You seem to have a lot on your plate and handling it so gracefully and doing a lot of good. And so I certainly, credit to all of you. But thank you for sharing those, Brett.
Yeah. I guess I would just like to follow up with some questions about some of those projects. Christy, since you were just starting telling us a little bit about your hospital gown research you've done, I'm reading about your bios and in your resume. I saw so much information about this, and I'd love to hear what you guys have found, the information that most excites you about that project, and yeah.
There was a class that I took, and one of the doctors mentioned that hospitals are like these dehumanizing funnels where you come in and you become a patient, a room, an MRN, and you just lose bits and pieces of your identity and who you are as a human being. And that he felt clothing and letting his patients in the ICU wear their clothes was one of those ways to take back their humanity. And initially, when I started the project in med school, my hope was to prove that hospital gowns were unnecessary and that we should just let people wear their own clothes and provide funds to be able to have clothing banks at hospitals to let people wear comfy pajamas instead. But I found out, and I talked with nurses, doctors, and then patients themselves, that hospital gowns were these necessary evil of sorts. You're always going to need them for the operating room, for imaging, and sometimes patients actually preferred them, especially some of the patients with cancer who I talked about who were having frequent trips to the bathroom or access to IV pools, and there are times where they're actually preferable. But a lot of times they felt like there could be improvements, but they felt like if they asked for an improvement, it would be like a complaint, or they didn't really want to rock the doctor-patient relationship. And when I talked with doctors and nurses, they felt guilty for giving patients and almost making the patient uniform something that they themselves would never wear. And so I talked with people about how they made meaning of hospital gowns and what people wear and should wear in the hospital. And I gave everyone the opportunity to color. And then at the end of my study, which was qualitative, meaning listening to conversations and looking for common themes, I found that people wanted something more colorful, warmer, softer, and more flexible and similar to clothing. So using what they talked about and what they draw, I came up with this prototype of something called YouMatter, which was an acronym for uniquely made attire tailored for tubes and testing, encouraging respect to try and give people their dignity back. And it's been a bit of a journey. I've been trying to patent it probably since 2020, and it has a patent in the European Union, but it's been a little bit more difficult in the United States. So that's been kind of like my hope to have people access it has been a little bit stalled, but I was able to carry that work forward with me in residency and then ask children with cancer how they made meaning of what they were in the hospital. And they kind of felt similarly too, where they felt like they couldn't challenge their doctor, but expressed a preference to wear their own clothing.
Wow, that's amazing. That is
yeah,
really
that's
cool.
Fascinating. I think so many people, myself included, don't think about, I would think someone who's in the hospital, that's the least of their concerns. So the last thing they're thinking about is their hospital gown or what they're wearing. But hearing you talk about that, it's, I think it hits home. That's all very valid how they would feel, if that's their day to day, they want to be comfortable. That's really a really unique course of study and project you had there. And that's really interesting.
Yeah, I can definitely tell you when I am in one of those hospital gowns, I feel very uncomfortable. So, and I'm terrible at fashion, so there's nothing to do with that. Very cool. John, I guess in a similar nature, I'd love to hear more about this mouth guard. Have you guys gotten it? Is it being tested with any athletes, or what stage in the process are you guys at?
Yeah, so we this is a project that I kind of ideated with my dad, who's a dentist, a while ago, and it took a while to finally get to fruition. My Ph.D, is funded to work on a set of things, and then you move to, your academic postdoc, and it's to do another set of things, and then you finally get to your own lab, and you can start your own research. And great, now I can start this. We are at the point where we have a provisional patent on this. We'll submit the full patent for that early next year in February is deadline. We are actively testing internally as part of the lab that I work with is the SHIELD lab. So my lab is focused on smarter health for innovating, enabling, and linking devices is the whole scope of it. So we're doing some internal testing on all the different sensors that are implemented. The novelty behind it is doing now a little bit more individualized assessments. So we now add postural control as a metric related to TBI, rather than just looking at the impact that was sustained. It's how did you prepare for it? How did you respond to it? And then we're looking at the post-catecholamine response. So basically how your body, autonomic functions change, your heart rate, your temperature, the other things that can be collected around bodily functions that are going to allow us to see how you reacted to that specific impact. And looking at it then from a machine learning perspective, which is also what my lab does, is then doing the classification. This was a actual concussive impact as diagnosed by a doctor. What are the signatures that lead up to that? And then also looking at post, how many impacts, can we have before we get into a multi, impact problem, or are they additive, or, how quickly does your body respond? All of those things are of interest for next steps. But the goal is to expand it past just the sporting domain. Ideally, we want to make it into a smaller implementation, where we can have it in like an Invisalign tray size. You could wear it while your day-to-day activities. It could help with car accidents, depicting, concussions related to that. We can put it into dentures to be able to help elderly populations for falls. There's a lot of applications that it can extend off of the same technology. So that's why we're patenting, the process as part of it, not just the device itself as well.
Wow. Yeah, I can see there would be a massive market for that, especially once you start getting into the day-to-day life. Just like I believe Whoop started as just something just for the most elite of the elite athletes, and then it slowly began. Everyone wants that data, and in a similar nature, that's just another data point with, especially with how many people are getting concussions playing soccer and football and basketball as a child. Like, to have that available in a mass market would be amazing. Very cool. Very cool.
Thank you.
And then finally you, Abbey, with Vampiro. I've been reading so much about this. It seems such like a cool idea. I'd love to hear how you guys came up with the idea, how you guys grew the confidence to go after it, and tell us a little bit of just about the project.
Absolutely. Thank you. I first have to say I'm so excited by John and Christy's ideas. I feel like an overlap, and I want to pick their brain offline a little bit more on the incredible work they're doing. Because we talk a lot about concussions and injuries in sports medicine and return to play, and that we're returning our athletes too soon and they're prone to injuries again. And Christy, I think the work you're doing is so true, and it resonates a lot with the pediatric patients I saw as well during residency. To segue over to Vampiro now. So truly similar actually to John, this idea came from my father, who is an acute care trauma surgeon. And he was doing an appendectomy, or the removal of an appendix, at like 2 a.m. On one shift, not a little while back at this point, but it was a case where he was trying to do it laparoscopically, and it was a complex case, and he had to end up opening up the patient or having a large incision versus a minimally invasive approach where you have small incisions. Because it was infected, it was difficult to get out. There were a lot of like bodily fluids in there, and the suction that existed to remove those fluids in that particular case was kind of ineffective and inefficient. So opening them up and using the instrumentation that they have available for open surgery proved to be a better option. Unfortunately, it's not always the better option for the patient. It means their recovery is longer. They're in the hospital longer as well. There's a chance for a higher risk of deep site surgical infection. So it's truly in the moment with these experts in the industry, or the people who are just doing their job every day, that these are the people that see the need, the opportunity to fix a problem. And then when you start asking people, what they teach us in STEAM is, get out of the building, ask the questions. And what we found out by interviewing upwards of probably 200 surgeons is that some of them live with the difficulties of the current instrumentation. Others, question it. They come up with their own workarounds, but honestly, they're strange. It's different ways of using existing instrumentation, or just alternatives, but it's not a solution. It's not solving the problem in a great way. So I would say we've really gained confidence in the ability to sell this device, or even create to sell this device, just from talking to other surgeons, putting the product in their hands, and them realizing, wow, this is really pretty clever. This is simple. It's obvious. Like, this makes sense. And when it kind of leaves your brain, your paper, your manufacturing company, and you get it out there with everyone else, that you begin to see, wow, that this is a solution that other people want to use, can use, have a need for. And that's what really started to grow the confidence in the product and the business.
Wow, that's really cool. That is I have my own entrepreneurial leanings, and to get from the spot where you guys had that idea to where you guys are actually going out there to 200 surgeons and talking to them, that is not easy. That takes a lot of humility and a lot of ambition. So I'm just so impressive that you're doing that. One follow-up I have is, how it sounds like you guys are selling these, and these are actually in the hands of surgeons right now. How are you guys getting these manufactured currently?
Yeah, so fair question. And honestly, I would say the manufacturing process is the easy side of things. It's getting it into the hospital that is actually the hardest part. So so as I said, the idea came out of Esteem. We use a local Mishawaka manufacturer. We did not take this out of the country. We kept it really local to Notre Dame, which is pretty special. And we've continued with that manufacturer since then. The device, obviously in medicine, you need sterilization of products, so it's safe to use in the human body, and you have to then comply with the FDA requirements. So our sterilization company's out on the West Coast, and we've had a good relationship with them. And then probably moving towards the harder parts, or what we've found to be the harder parts of this process, is the FDA and going through all of the required testing, having the necessary documentation. The compliance and testing required is just pretty incredible, especially as a startup company with no expertise in this area, trying to find your way and navigate what is a complex process, but for a good reason, to keep our patients safe. And then ultimately, one of the harder angles of this is actually getting it in the hands of surgeons. What's unique in healthcare, in this industry in particular, is that you have the surgeon that you're selling your idea to. You want them to be interested in it, but they're not the ones paying for this product. It's the CFOs, it's the management of the hospital. So you need to also sell it to a second customer, so to speak, or you have this dual customer unit where you have to convince the administrators that your product is worthwhile to have in the hospitals. You're going to reduce infection. You're going to save them money, save them time, whatever that argument is. So it's a two-part problem to tackle, so to speak. And every hospital is different, probably unsurprisingly, that in how their processes are. So getting it manufactured, honestly, on the easier end. Everything about getting into the hospitals presents some big challenges, but has been the journey in all of this lately.
Yeah, I can imagine, these hospitals, I'm sure, see many pitches and new ideas every day. So again, just more of a kudos to you and your team for getting it to the level that it's at, and the fact that it's, being used and making improvements is truly great. So you guys have all worked or studied, in the medical field, medical technology, for almost a decade. And so I'd love to know what have been some of the biggest changes that you have seen in the industry, and how have you adapted to them? Maybe, implications that COVID-19 had on your work in 2020. I'm sure that's a topic you guys could probably talk for days about, but, just in general, really over the last decade, how have things changed, and how have you guys individually adapted your work to those changes?
I think one thing is virtual healthcare, like for better or for worse, Zoom became a huge thing during the pandemic. And I think that there's a kind of a pros and cons to virtual visits, where you sometimes do miss that direct human contact. But for some families seeking care, especially in pediatric, where there are kids who are medically complex and may need equipment, or families live hours away, there are still visits that you can do meaningfully over the computer. So I think that's been one kind of pearl out of the COVID pandemic. It's not always a perfect visit to have something virtual, because I still think there is something to be said for having that in-person interaction in your physical exam and just building rapport in person. But I do think it has broken down some barriers and given better access to care to people farther away, or for whom it's harder to get to care.
Yeah, absolutely. I think that's true of all types of interaction as well. It's fantastic now how much we can Zoom and FaceTime with people all across the country, but there is always something to that in-person interaction, especially in the medical world. So certainly understandable.
Yeah, I think from my side, the technology angle, computer science, it's grown, 5 or 6 different ways in the past decade, right? Obviously, the virtual healthcare is a big part of it. And, building out some of those things with, chatbots and using that for personalized therapies. But even just the AI, how many FDA regulated AI mechanisms are in, production for diagnostics already? I teach it in my smart health class. There's over 200 just imaging based ones. You expand it to then other medical devices that are doing this on device or edge computing. So you don't even have to ship it to the cloud or send it to Epic, the back end patient database. you're doing some of these things on your person regularly. Deep brain stimulation I work with for Parkinson's population, and we can reprogram some of that stuff remotely, right? And it's like, this was never really possible when we were doing things a decade ago, when I was doing my undergrad in biomedical engineering. So there's a ton of different ways I think that it's grown. I was maybe fortunately or unfortunately at Notre Dame while COVID happened during my PhD, where I was trying to collect data, and it derailed all of that. So it gave me an extra year. That's the best part of an extra year at Notre Dame to work on stuff. But in terms of actually being able to access populations and do some of the work that we needed to get interviews and to have cognitive testing, that took a big hit during that time. So I think, at least from my perspective, it's taken off a lot of things and improved them. Obviously, we're meeting virtually right now. We got people from all over the place, so this is at least exciting as an opportunity. But I think then the hardest part is, how do we still make sure that all the right people are in the room to drive the solutions that we're trying to make, and from there we can make it wherever we need to.
Certainly. I just really, to piggyback on both of those answers and kind of blend the two, I think we're finally changing how we think about healthcare. In training, you may hear often in certain specialties, this is how I learn, so this is how you have to learn too. And people never questioned that. They felt like it was a rite of passage, and this is how medicine has to be. And I truly think the COVID pandemic forced people to change and think outside of the box and learn in a different way. And I'm so excited for this, because I think we'll start to see exponential growth and innovation in the medical space, how we treat patients clinically, but how our learners, how our residents, fellows, and med students actually learn. And I think that's going to prove advantageous for years to come.
Awesome. We have a question from a participant when they were registering for John. And they asked, how can someone not currently involved in medicine, who's more on the engineering side of things, get involved in creating these technologies for better patient outcomes?
Yeah, I think that's the fact that they're asking that question, they're already halfway there, right? In the engineering field, we like to tinker. We have a lot of ideas. For me, it was always, if you tell me what you want, I can make it, right? It's really just asking, what's the need? Who needs it? What are some of my requirements? And that iterative design, right? You're going to go back and forth and say, here's what, you told me to do. And they're going to be like, yeah, I don't like that anymore. Change it. And you're like, okay, I'll change it, make it better, right? But the willingness to have some of that iterative design, the willingness to ask that question, like Abby was saying, sometimes they're making their own workarounds anyways, right? And if you can do it faster, cheaper, come at it from a different perspective, and complement their idea, that's the biggest part of this. So biggest thing I like to say, make sure you're in the room with people that are doing things that you might be interested in. Pick their brains, and likely they're going to come back and find a way to inspire something new out of you, that's going to drive that entry. Once you're in the medical field, it gets its claws into you. You won't get out, right? There's so much opportunity. There's so much need. Everybody is affected by health, yourself, your family, those that you don't even know. And there's so many different avenues, whether you're making new devices, you're building off of commercial devices, you're going to find something. And once you find it, it's like a domino. You'll go to the next, and you'll use those building blocks to keep expanding your efforts and your impact on that area.
Absolutely. I mean, engineers they're problem solvers, right? So they just gotta find the problem, and that's where it starts. Thank you. And for anyone who is tuned in, if you have any questions that you want to submit, feel free to put them in the chat on the right side of the page.
Absolutely. And the next question, this one's I'll aim it towards Abbey to start. We'll move over to Christy after. Are there any things from your time at Notre Dame that you took with you into med school, your residencies, your business, that stand out and you share with us?
Yeah, absolutely. I think when I think back to my time at Notre Dame, that you savor some of these relationships that you develop and create over that time, and it's a very special growth chapter in our lives. We go from living at home with our families to stepping out into the world, and it helps you figure out who you are. And I think remembering that as you kind of go through medical school and go through residency, that's a challenging time. That is a long journey. As one of the other questions alluded to, like, we've been in this training for close to 10 years at this point, and you have to have this understanding and sense of delayed gratification for sure. But when you're in these moments, it's so important to take a step back and remember the big picture of why we are doing this and what got us here in the first place. I think that was something that Notre Dame did a really good job of instilling in me. It's just appreciating the moment, being present in that moment. And it's so easy to get wrapped into this journey and the challenges with it, but also just the hard moments, the day-to-day, that it is good to take a step back and remember why you got here, how you got here, and the meaningful work you're doing every day.
That's so true. Even when I think back to my time at Notre Dame, I often, if I'm going through a rough patch in my day-to-day life nowadays, I often think about what made me so happy and so feel such a sense of community there. And I kind of try to emulate that in my day-to-day here. Christy, I'll ask you the same question. What I'll repeat it for you. What are some things that from your time at Notre Dame that you took away into your residency med school current career?
I think Notre Dame just has this holistic way of looking at its people, and that you're not just a student and not just a number. You're a person with likes and dislikes and worries and hopes and dreams, and you're not just a number here. And I think that's what I've taken with me, just meeting people where they're at and recognizing that it's just so much bigger than you or me. And I also think the grotto is one of my favorite places of Notre Dame, and having left Notre Dame, there's nowhere quite like it, and there's especially nowhere quite like the grotto, except maybe Lourdes, France. But I think making time for reflection in your life, especially amidst the hustle and bustle of medical training when everything could feel so loud, like being meaningful with your moments of reflection, which is so much easier said than done, especially when you aren't just like a 10-minute walk to the grotto. And then, like, if you could walk across South Quad in the middle of the wind tunnel in an Indiana winter, that you can get through anything in medical training.
Absolutely. And I get just what you said about every person mattering and putting that into your work. I can definitely see that in the work you're doing, and it's admirable, if not inspiring. And then finally, John, now as an award-winning professor, are there any professors you had or classes you took during your time at ND that influence the way that you teach?
Yeah, there's a few, and I'll call them out by name, I guess. Pat Flynn, I took his class for biometrics. Ramsey Boulan, we did a lot of TAing with him as part of the intro to computing. And then my advisor is Chris Polabauer. He was at Notre Dame for quite a while, and I was his last PhD student actually at Notre Dame. But interacting with them in so many different ways, using their experience, kind of making my classroom feel the same. The interaction, I hate just talking at people. I want to have them respond and engage and have their hands on things and actually be able to work in developing something as part of the class that they're in. Those things are all super important to me, and things that I've emulated in developing my own courses. My Smart and Connected Health elective that I teach now. I actually taught its first version as an adjunct faculty at Notre Dame right after I finished my Ph.D. And even just the experiences that the students at Notre Dame gave me during that has improved that course, exponentially, just from one iteration. And it's something that has now been 3 iterations of. We're working with clinicians as part of the class. I had 28 projects this last year. 5 of them led to publication. 2 of them led to patent. We're working on, actually making an impact with clinical application as part of that coursework. And I think that is something that, is really exciting, rather than just, here's the information, memorize it for the test. Right? You're doing something with what you're learning immediately. So that's how I try and teach.
That's awesome. I know, whether I did not go on to any further education, but there's still certainly things I took from my time at Notre Dame, both from the student and academic side and just personally as well. Abbey, Christy, you guys both talked about, how easy it is to get wrapped up in the day-to-day of work, and talked about reflecting and kind of taking some time for yourself. So maybe on a little bit of a lighter note, what are some things that you all like to do in your free time to stay kind of mentally fresh and to take a step back from your busy, very technical work lives?
I can think of two things offhand for me, or 3. Probably the list can continue, but I wish you always wish you had a little more time than you have. First and foremost, I think exercise is important for me. That is something that I incorporate every day in some capacity. It could be a light workout, it could be a longer run, things like that. But I just the endorphins and the serotonin that you get from exercise of running and releasing kind of your mind from the day-to-day challenges and work obligations and things like that, I think has been instrumental in me for staying physically and mentally healthy through med school, residency, and now fellowship. Not something I can ever imagine giving up. And even when the days get busier, that means you need to make more of an effort to integrate that. Second, I would say my dog Eloise. She's a Saint Bernard. She is one of the best things to come home to at the end of a long work day, and something that just, you get unconditional love. And she's such a joy to have in my life that definitely is a way to kind of separate from some of the challenges of the day. And then when I have a little bit longer time off, I love to travel. I love to see family and catch up with friends. And I think that's so important to not lose sight of those things either, whether it's just traveling home for a holiday, even if it's for 2 days, it does a lot for the soul, and it does a lot for your support system and loved ones around you. So those are probably my top 3 right now.
That's awesome. Awesome.
I like
Christy or John? Yeah.
I like to go on adventures and not really have a plan, because I think so much of my day-to-day is planned that I feel itchy when my free time has a plan. So I like to kind of just discover things with serendipity, like pick a spot to walk to or take a train to, and then just explore with no agenda. Sometimes that just happens in Trader Joe's, and then I end up with a bunch of snacks. Or I ended up in a beach town in Maine last weekend. But I think just kind of having a flexibility with my free time and to get out of the structure. And then the arts resonate with me. I think my attention span has gotten worse with time. So books have been hard to read. So it's usually more poetry that resonates with me, because I think I can attend to it for longer because they're usually shorter. And one poem that's been sticking with me is Wild Geese by Mary Oliver.
Amazing. Any adventure that ends in a trip to Trader Joe's is a good adventure. So
Big plus. Yeah, I think for me, it's very similar to both answers from Abby and Christy. I just love being outside. Maybe I photosynthesize, as much as the plants do. I just want to be in the sunlight as much as possible, which is tough working in computer science, where you're expected to just be behind a desk and a computer screen all the time. I love sports, any and everything. I will go play. Last summer I was in Europe and I found myself playing cricket at a park. And it's like I played baseball growing up, but it's similar enough. I'll figure it out. I have maybe gotten into running. I wouldn't say I'm a good runner. I do like it for the same reasons Abby said. But I also do like to think, about, what my work is going to do. Because some of the weirdest ideas pop in your head at mile 6 on a 13-mile run, and you're like, okay, yeah, let's remember that and file it for, later. Because maybe you're just exhausted and that's the only thing you can think of. But just anything active. And then because I like to tinker with my hands as an engineer still, I do a lot of like other types of crafts, woodworking, metalworking. I've been sewing recently, just kind of keeping my hands busy, doing something, because it takes that mental, cognitive load off, but you still feel productive and you're still, seeing something come to life, in a different lens. So those are all things that I would say too.
Yeah, absolutely. I think one thing that's great with the craft side of things too is it takes you away from a screen. It's, at work and even just in daily life, I know I'm staring at a computer screen, I'm staring at my phone, but when I do get home and I pull out, I like to needlepoint. It's like I'm looking at something that's not a screen, and that is something that I definitely need to spend less time doing. So absolutely. No, those are all great. And I think a lot of people can resonate with a lot of those answers.
And it looks like we have a good question from the chat I want to ask to you guys. So this is from Joey Murphy. He says, from funding challenges to AI, healthcare is constantly impacted by broader changes. Looking out 10 years, what is one thing in the industry that worries you, and what is one thing that instills hope? I'll let anyone who wants to start.
A little bit of a loaded question there.
Yeah. Tough one there.
You need to tag team it too. If one person has something about instilling hope, one thing that worries them, we're all ears.
Honestly, I would say, coming from a clinical perspective, something that worries me from a clinical perspective is the emphasis that's being placed on seeing as many patients as fast as possible to generate as much revenue as possible. It seems like it all comes down to a dollar sign. And to do that, there's a potential for compromising care, there's a potential for taking out the humanity in medicine, and you're putting this focus not on clinical outcomes, but more so on dollars through the hospital, dollars to the certain companies, insurance companies, things like that. And that is challenging to see because it has informed, or it's weaved its way into my fellowship more than I anticipated, that they're preparing you for how to practice medicine in this world. And that education is no longer limited to just the clinical side of things. It's very much about how to manage your practice, how to operate and bill, and in some ways that make you think that this is dominating more than just the clinical side and the right reasons. But what does give me hope, I would say, are the physicians that refuse to give up the compassion for our patients and refuse to lose that humanity, and do spend that extra 5 minutes talking to that patient about their Thanksgiving or their upcoming, holiday plans and things like that, because that reminds you why you got into it and the humanity that medicine has and what you love about it. So don't lose that, and I think we'll be okay in the future.
Yeah, I think from my side on the AI angle, maybe the tech side only, the thing that worries me probably the most is the sheer amount of data that we're going to have. Everybody's all aboard, wearables and apps and, the medical, digital medical records. You think about how many people are in the world and how much data we're going to amass and all the models that we're going to try and build on that. In my smart health class, I teach about, we're going to get to the exabyte range. That's a billion gigs per person is the expectation over the next couple decades. And you're trying to use that to generate your personalized profile of how to take care of yourself. There's a lot of environmental, impacts. There's a lot of, how do I store that? How do I collect it, offload, etc. But I do think that the thing from the tech side that gives hope is more people in my opinion, are interested and engaged with preventive medicine rather than everything being strictly curative. I want to wear my smartwatch and see how active I am and see how, my sleep score is and how can I eat better and use some of these apps to do these things. People are engaging with that material in an exciting way. And I think that, if we can take some of the burden of strict curative medicine off of clinicians, where I come in because I didn't take care of myself for the past decade and now figure out how to help me, that should remove some of that impact on the clinicians to spend more time with those higher risk patients or with those patients that really have, an edge case condition that needs some extra attention. So maybe that's just from the tech angle, but I think that those are two things to look at.
Kind of bridging what both Abby and John said, one of the things I've worried about with AI is that, like Abby said, we already have such this kind of inhumane level of efficiency that you have to achieve in the medical field. And if there's something that makes you potentially more efficient, sometimes I wonder if the workload will eventually become insurmountable, and that if the things that you actually like to do that give you joy would be kind of told to be taken away by a computer. In one of my research programs I also do work in parental bereavement, and my favorite part was reading about how parents talked about their child. And someone asked me and said, like, wouldn't it just be easier for AI to look at the conversations and divide themes? And like, maybe, but that would take away the meaning and the fun and the thought of it all. So that's kind of one of my worries, is that as AI develops and like your definition of productivity and efficiency evolves with that too, maybe not in the positive way. But I think with AI has been this flux of creativity and causing us to rethink the status quo. And a lot of times in the research world now, there's more clinical research rather than just bench research in oncology and focusing on patients as whole people. And there's moves to put patient partners in studies and changes to different grant and clinical trial requirements to try and make it a more holistic approach to research as well. And I think that stems with some of the creativity that's been happening.
Yeah, absolutely. I think regardless of industry, we all have our hopes and our worries for where AI is fitting and in our personal lives as well. So appreciate each of you kind of sharing some of that insight. As we kind of start to wrap up here, would love to hear what is next for each of you. Any exciting projects on the horizon or goals that you have for the next steps in each of your individual careers?
Yeah, I think for me, my biggest goal is seeing what other areas of health I can apply some of the things that we're doing to. I'm already working in the cancer domain, the cardiology domain, the neurology space, public health, right? But there's so many distinct areas in each one of those sectors to be able to reach and make an impact for. So, nice part, we're still all young in our careers and have a lot of time to be able to do this over the hopefully next few decades. But I'm looking forward to those interactions with different clinicians, with, both young, new incoming, how do we make it easier for you? And then for the older, clinicians as well, that, you've seen it. How do I, engage and make the newer clinicians' lives easier? I'm really excited, obviously, about the mouthguard project. I mean, ideally, it's in something where youth athletes, my kids at some point, in the future are playing sports and wearing this thing. And we're seeing all this, real time in front of you. I think that's, my new athletics dream. I still want to be a professional baseball player, even though that ship has sailed. So this will be my secondary implementation there. And then personally, next year, I'm really excited. I'm going to be running a couple marathons and trying to see, how I can push myself, physically, how I can, manage some of those things mentally and, kind of encompass my job into things that I'm doing, more day to day, every day. Because I think that a lot of the creativity comes to you in very unique situations. It's not only behind the desk that you're experiencing some of these things. It's out, in different places, with different people. If I can raise money for a good cause along the way, I'll shout out the Cystic Fibrosis Foundation for that. I might as well do that too. So that's what I'm looking forward to next.
Wow, John called himself a casual runner and has 2 marathons.
That's what I was thinking.
What does that make me? Oh my gosh.
My marathon pace is like just sub 5, so I'm not quick at all. But I can't complete
about
one.
finishing. It's about what marathons are you running? Which 2?
As of right now, I have Chicago and Mesa in Arizona.
Awesome.
I'm in talks to also get New York and Boston next year for the Cystic Fibrosis Foundation too, but we haven't heard back on those 2 yet. So could be 4 next year.
Best
of luck with
that. That's, I don't know if marathons have majors, but those are the majors of the marathons. So.
Yeah.
As a sports medicine fellow, make sure you take time to rest too, okay?
Oh, yes.
You got a lot of miles coming up ahead of you, but those are exciting.
Absolutely.
New York is a special marathon to be a part of, so hope you make your way this way. For me, though, to just kind of keep it simple, I'm really reflecting right now on how can I blend everything that I have done, or more specifically, how can I blend the clinical side with my love of entrepreneurship? I feel like I've had these 2 parallel paths going. I've had to emphasize the clinical side more during my training, and I've let go of some of that entrepreneurial side. And I really keep coming back that I love the balance between the 2, and I want to try to figure out how to balance them in this next step. So this will be the first time I'm done with training in the next year. You're never really done, but done from that standpoint, that I can hopefully start to figure out how to weave the 2 in on a more regular basis. So I'm really looking forward to that.
I'll be headed to Rochester next July for another year of training. So lucky postgraduate year number 7 for palliative care. I'm looking forward to being back with the Department of Humanities, which I haven't really been with since medical school. And there are a lot of doctors there who do narrative work like I do. So I'm looking forward to learning from them about how to help people tell their story, and also how to figure out how I tell mine and what my story looks like. And I will not be running any marathons, just short walks to the fridge and then Netflix and Trader Joe's. Mm-hmm.
There you go. Everyone's marathons look different,
Wonderful. Well, thank all 3 of you guys for coming and talking with us. This has been a really cool conversation. I'm inspired by all 3 of you guys. I wish we could talk for another hour to each of you individually. Some of these projects you guys are working on are just really cool. Young alumni have so much to learn from leaders like you guys, and we're really grateful for your time. And thank you to the audience as well for coming and asking such good questions, being involved. We will have more of these, and we do these every single year with such cool alumni from Notre Dame. One of the best ways to keep in touch with everything YoungND is by following us on Instagram at YoungND alumni, and also follow our panelists. I mean, they're doing amazing things, and follow them on LinkedIn, follow them wherever you can to keep in touch and see what they're doing, because they're going to be doing amazing things. But thank you all for joining, and have a wonderful night.
Thank you.
Thank you, guys.
Go Irish.
Go Irish.